Good afternoon, everyone. Welcome back. My name is Dr. Malik Rahim, and in this session, we're going to talk about a brief lecture on research and program evaluation. And research is essential to the counseling profession because it allows counselors to evaluate effectiveness of their counseling interventions, improve mental health services, and develop evidence-based practices. And finally, assessing counseling programs and outcomes. And in this domain, um, we're going to talk about things like, in this brief lecture, things like the purpose of research and counseling, types of research methods, quantitative and qualitative research, different types of research designs, the variables and hypotheses, basic statistical concepts, and program evaluation and counseling. Okay. When we look at the purpose of research and counseling, we got to understand that research helps counselors determine whether counseling practices are effective and beneficial for clients. Evidence based counseling relies on research findings to guide clinical decision making. Research can help answer questions such as which counseling approaches are most effective, what interventions improve mental health outcomes, how can counseling programs be improved. Research also helps counselors develop ethical and scientifically grounded practices. When we look at the types of research, there are two primary types of research approaches in counseling. Really three, but I'll briefly I'll talk about these main two. One is mixed method, and it's a combination of these two. But it's quantitative research, and quantitative research focuses on numerical data and statistical analysis. Researchers measure variables and analyze relationship between them. So examples of this type of research include experimental studies, surveys with numerical data, and statistical comparisons. And usually the goal of this is to identify patterns and test hypotheses which measurable using measurable data. Then you have qualitative research. Qualitative research focuses on understanding how human experiences and perspectives um, focus and develop things. So instead of numbers, qualitative research uses interviews, observations, and narrative data. Okay, and the goal is to explore how individuals interpret and experience their world. Qualitative methods are often used when studying complex human experiences such as trauma, identity, or relationships. And like I said, beginning, there's a third type, but really it's kind of like a combination. It's a combination of these two, and it's quantitative and qualitative combined called mixed method. Okay, and that's when you use both methods in your research. Research designs refers to the structure used to conduct the study. So several research designs are commonly used in counseling research. So let's briefly look at them. First, there's experimental design. And experimental research examines cause and effect relationships. Participants are randomly assigned to groups. Typical groups include experimental groups and a control group. So a researcher may test whether a new counseling intervention reduces anxiety. So experimental design allows research to identify causal relationship, right? However, experimental designs may be difficult to implement in real world counseling settings. You have quasi experimental designs, and quasi experimental research examines relationship between variables without random assignment. These designs is often used in educational and counseling settings. Okay. Um, Descriptive research aims to describe characteristics of a population. An example of this include surveys, observational studies. These designs does not attempt to determine cause and effect. When it comes to variables in research, variables are the factors researchers study in an experiment. And there are three types of variables I want to talk about. The first one is the independent variable. The independent variable is the factor manipulated by the researcher. Type example that would be a type of counseling intervention. All right. The dependent variable. The dependent variable is the outcome being measured. Reduction in depression symptoms. Okay. Then you have the control variable, and the control variables are factors kept constant to prevent them from influencing the results. Understanding these variables help researchers determine whether changes in outcomes are caused by the intervention. We cannot do research without discussing hypothesis. Okay, and a hypothesis is a testable prediction about the relationship between variables. In research, there's a thing called the null hypothesis. And the null hypothesis assumes no relationship between variables. So what you do is you try to disprove your hypothesis by trying to prove the null hypothesis. So you go with a counseling intervention has no effect. So if you disprove the null hypothesis, it means you proved your hypothesis. Or alternative hypothesis. Alternative hypothesis predicts that a relationship exists. A counseling intervention reduces anxiety symptoms. Researchers collect data to determine whether the null hypothesis can be rejected. Okay? Statistical concepts is very, very important. And statistics are used to analyze research data. So let me go over a few of them and briefly tell you what they are. But like I said, go to this, the purple book, and it'll help you. Okay, but this is supposed to, help you. First, there's the measures of central tendency. Okay, and you keep hearing that. And the measures of central tendency, these measures describe the average value of a data set. So first, you go the mean. The mean is the arithmetic average. Okay, median. The median is the middle value in a data set. And the mode is the most frequently occurring value. Another statistical measure is the measures of variability. Variability describes how spread out the data is, right? The range, the difference between the highest and the lowest of the values. The standard deviation measures how much scores vary from the average. A small standard deviation indicates that scores are clustered closely around the mean. Then you have correlation, and correlation examines the relationship between two variables. Correlation coefficients range from a -1 to a +1. Okay? Positive correlation means both variables increase together, right? Or they both decrease together. A negative correlation is that both variables decrease together. Okay? Well, let me rephrase that. A positive correlation is whether both variables are going in the same direction together, either positive or negative. That's okay. A negative correlation is one variable increases while the other one decreases. Okay. A zero correlation, no relationship exists between variables. It is important to remember that correlation does not imply causation. When it comes to program evaluation examines whether counseling programs are effective and meeting their intended goals. Counselors often conduct program evaluations in schools, community mental health programs, nonprofit organizations, and healthcare systems. Program evaluations help determine whether services are effective, how programs can be improved, whether funding should continue. Types of program evaluation include things like formative evaluation. Formative evaluation occurs during program development. Its purpose is to improve program design. Summative evaluation. Summative evaluation occurs after program implementation. Its purpose is to assess the overall effectiveness of the program. When we go to evidence based practice, it involves integrating research evidence, clinical expertise, and client preferences. Counselors should use research findings to guide treatment decisions while using consideration and considering the unique needs of each client. Okay, so when studying the major research concepts, you should remember and focus in on the difference between quantitative and qualitative research. What's experimental design and what's a quasi experimental design? Independent and dependent variables. What is a hypothesis? What is correlation? You should also know the basic statistical concepts such as the mean, the median, the mode, and the standard deviation. When it comes to program evaluation, concepts that frequently appear on exams, particularly the difference between formative evaluation and summative evaluation. Okay? So, in closing, research and program evaluation are essential for advancing the counseling profession. By understanding research methods and evaluation strategies, counselors can ensure that their work is effective, ethical, and grounded in scientific evidence. This concludes all our 8 core domains. If you have any questions, do not hesitate to put them in the comment section, and I will make a video attempting to help you with your question. So I'd like to thank you, and hopefully these 8 domains are